Until you go to a crowded NICU and you see that there are 60 babies and only 2 nurses who are there to provide care for them, and they basically have no technology.
And there were some beds that had 4 or 5 babies in a bed. And to go back the next day, and only one of those babies was still there.
It's hard to leave that without it changing you.
We are in bioengineering, so thinking about medical technologies that will improve health. Our particular area is sort of medical technologies, working in the clinic.
And so we spent 2 weeks where we traveled to Swaziland, Lesotho, Botswana, and Malawi. We just realized how much potential there was for our students to be able to design devices that could truly transform healthcare in that setting.
We need to design technologies that will make a difference and be repairable and useful in that environment, all while getting our students to have the moments like Rebecca was talking about where they have that aha moment that I personally can make a difference.
We decided that we wanted to start a program called Beyond Traditional Borders that would focus on engaging undergraduate students in designing appropriate technologies that could improve healthcare in very, very low resource settings.
These students go on and realize that they can at least have a part of their lives where they're focusing on making a difference for the world in one way or another. We've developed a bubble CPAP device that allows babies that are struggling to breathe to have an easier time with breathing. So what this device does is it puts pressurized air into their lungs. It keeps them inflated, a little bit like a balloon being a bit inflated. It makes it much easier for them to get the oxygen they need so that they can thrive and grow and develop their lungs more effectively. Puma is breath in Chichewa. And so we picked a name that the nurses suggested to us that would be appropriate for the technology. When you allow them to relax while they're breathing, where they don't have to inflate their lungs fully, then they can relax and get the oxygen they need, but they can also grow and thrive as a baby. So for some children, it just takes a few days on this device and their lungs can more fully develop, and then they don't need the technology anymore. One of the challenges that was described to us over and over by clinicians in the field was their concern that the mothers or grandmothers might not be able to effectively dose liquid medications. It's really, really important to give exactly the right dosage. So our students designed this DishRight dosing clip, and it's a clip that fits into the body of the syringe, locks into place, and every time you draw up the syringe, it will draw up exactly the right amount of medication.
We want students to learn about global health. We want students to learn about engineering design, but they are engaged in that process, and that is how they learn. And I think that only works when you have real challenges that you're asking them to solve. And I think our experience has been very much that when students appreciate the impact that their work could have if they're successful, they are so motivated. They spend hours and hours trying to make their prototypes work.
There are children back there.
Yeah, between us we have 10. As moms, we really are motivated to try and bring the very best healthcare that we can to places in the developing world.
Because it doesn't take complicated technology to make a difference. I think it takes a different way of thinking about the world, and I think these problems, these challenges are so invisible, and once they become visible to you, once they become real to you, it just changes the way you do your work.
No one person is going to solve these problems. It's going to take the team, and if we can pull that team together and teach students that they need to be part of a team from the beginning, then we will have success.
This month, do you have to go back to school?